All right. Hello and welcome, everyone. Thank you for joining us today. It has been 2 weeks since we last got together, so we have quite a few things to update you on. I am joined today by Spectrum Health Lakeland President Loren Hamel and Acting Health Officer for the Berrien County Health Department, Courtney Davis. So we will go ahead and get started with you, Courtney, if you just want to update us on what's been happening in the last 2 weeks here in Berrien County.
Sure, absolutely. So it's been a busy 2 weeks. We know we're in that summer end back to fall. Unfortunately, we've continued to see our cases rising during that time. We've seen that increased transmission here in Berrien County and surrounding areas. So two of the important metrics that we continue to watch when we look at that is our percent positivity and our 7-day cumulative case rate. All of those do have us in high transmission. Right now, what that looks like is we're seeing on average just about 40 new cases a day, and that is still increasing. When we look over that 7-day cumulative average, that's 165 weekly cases per 100,000 a week. And then our percent positivity has continued to have that increase, and we're sitting really in about that 13% for percent positivity at this time. When we look over kind of just the course of our summer, here in the month of August, we've had a reported of 829 confirmed and probable cases in Berrien County. This is actually more than a 4-fold increase from what we reported in July. In July, that number was 156. And so then when we look at that year over year, August last year, this time, that's a 73% increase from what we reported then. I think what we can see from those numbers is certainly the impact of higher transmissible variants like Delta activity in our community. We're seeing those increases in that transmission and really trying to align recommendations to curb that growth as we move here into fall. Other metrics that the health department is certainly looking at and making sure we are looking at this holistic picture as we make decisions and recommendations is watching our hospitalizations. Dr. Hamel is going to be able to speak to that much more closely. And then our vaccination rates. We are still encouraging people to get in. We have 3 safe and effective vaccines. We have clinics. We're very lucky in Berrien County to have a number of vaccination partners and have vaccines available across our community. We're seeing those numbers slowly increase, but we would like to see that a bit more rapidly. As well as just our overall capacity to cut the chain of transmission, to keep up with case investigation, contact tracing. With our increasing transmission, we've certainly felt the burden of that increased time and need in that area of our community.
And we know that schools are back in session, and with those high transmission rates that you just mentioned, what is taking place to mitigate the spread of COVID in our school settings?
Yeah, it's a great question. So we've really been working with our schools for the entire course of the pandemic. We have great school and education partners. And right now with this higher transmission, it's really important to be layering on a number of prevention and mitigation strategies. So I know we've talked in the past about the Swiss cheese model and making sure those holes don't align, but adding on different layers of defenses that can really, again, protect our teachers, our staff, cut that chain of transmission, make sure things are not impacting home life from that. One of those key things that we know is safe and effective and works for cutting the chain of transmission is masking. You probably all saw out of the health department last week, we did issue a public health order for masking in pre-K through grade 12 settings in our educational institutions in the county. More about that order and all of the supporting documents are available on the Berrien County website, so you can see those there. But really our layering of these prevention strategies is about prioritizing in-person learning. We know the impact of having kids home and remote, and we don't want to see that. We want social interaction. We want kids in school. We don't want them impacted with quarantine. We also know the more layers we put on that does protect our most vulnerable in the classrooms too, whether that be staff or students who might have other underlying health conditions or even live in multifamily settings where that can impact the home. So really continuing to layer that on. Other things that we work with schools around is, of course, that layer of masking, but encouraging vaccination for those 12 and older. We know we still don't have vaccination for under 12 at this point. social distancing to the extent possible, not having those extra large gatherings, hand hygiene, washing hands, the proper etiquette for coughs and sneezes. Those things are still really important. Cleaning and disinfecting. And then, a really big one, if you're not feeling well, staying home, not being in school for the day. We really are working to just kind of support that overall school community to be successful this year. One thing that has really driven a lot of this is just our cases we saw even in our first 4 days of school. So last week was the first week for many of our schools. In the first 4 days of school, we had 26 cases for staff and students, which resulted in over 83 quarantines. So that's a lot of time out of the classroom. Universal masking allows us to exclude a lot less students and ensure that the transmission levels come down. So that's what we're working with schools at this time.
Thank you. And Dr. Hamel, turning over to you, what's important for the community to know about what's happening at Spectrum Health Lakeland?
Well, we certainly are seeing more COVID cases in the hospital. That's growing slowly week by week. About a month ago, we had just a handful, just a few in the hospital. Now we have a couple dozen. It looks like we're going to be over 30 average by next week. We've been that high just recently, but we've seen some trends that are a little different. There are a few folks in the hospital that have had a vaccination. Most of them are older. And we know that the immunity related to a vaccination wanes a bit over time. As you can get sick, not as likely. You can be hospitalized, not as likely. You can die, much less likely. What we're seeing is more folks in the hospital proportionally that are unvaccinated, and we're also seeing them much younger. I watched out my window the other day as a 30-year-old was airlifted out of Lakeland to get a treatment called ECMO. ECMO is where you pump the blood out of a person's body, oxygenate it, and then pump it back in. That's when the heart and the lungs can no longer deliver oxygen to the tissue. It's a last-ditch effort to buy a little time to save a life. We're doing that now across the country, and in Berrien County, we're doing that on much younger individuals than we saw sick in the first round with COVID, in the first surge or the second surge of COVID. We're seeing that in 30-year-olds. That's a new trend. As we look at the positivity rate, now up 13, 14%, and project what's going to come in the next week or two, we know we're going to see more of our friends and neighbors in the hospital. We know we're going to see more that are very sick in the hospital. And we just encourage you, be careful. Make sure that you're continuing to protect yourself and your family from transmission. Even if you've had the vaccine, you need to still be careful. This epidemic is not over yet. Make sure you continue your masking and your distancing and your hand hygiene.
And if someone is feeling sick, we know flu season's on the horizon as well. If someone is sick and not experiencing life-threatening conditions, what is the first thing that they should do, or what's the first step they should take?
Oh, for sure. If you are at all concerned about COVID and with any respiratory symptom, you need to be. We are seeing other things circulate in our community that isn't COVID. But if you have respiratory symptoms and concerned about COVID, you should be tested. You don't need to run to the emergency room unless you're very sick, but call your primary care physician. We have visits available, testing available to help you. Make sure you contact your primary care physician. We also have new equipment that allows us to run tests much quicker. We can do in a few hours what used to take us a day or two to do with new equipment. So call your primary care physician, and we're there to care for you.
Thank you. And Courtney, on that note, are there some recommendations that people could do at home if they're having mild symptoms, or how can you support your body's natural defenses in this?
Sure. So I mean, one thing, said this before, if you're not feeling well, it is important, if you can, just stay home, keep yourself healing there. So you might be recommended. And again, it's always really important to touch base with your healthcare provider, have that, but you might be recommended to take medication like ibuprofen or something to reduce a fever if those are some of the symptoms that you're experiencing. It's always good when you're not feeling well in general, just to drink good hydration, to have water, to make sure that you're keeping your body hydrated and rested. and continue to get that rest that you need. We know things like sleep and allowing your body just that time to rest can really regenerate you and make sure that you are healing and well. So all of those things would always encourage folks, though, that you really should consult with your healthcare provider. Use those My Chart messages or what you can just to get that guidance from home. Stay home, don't be going to work and social events, and really take the advice of medical experts. I know that we have seen some individuals really kind of self-medicating with things like ivermectin. We've all seen those news articles. That is a horse dewormer. We would really encourage that folks really understand that there has been some serious harm from doing that. We have seen deaths after taking products that are not recommended or approved for COVID-19. So we would just, again, from public health, really encourage you, the sleep, the hydration, if you have the fever reducer, but really seeking consultation with your healthcare provider.
And
Now,
one of those,
I'll add to that for just a second. I know it's confusing. When you are searching the internet on early treatment of COVID, you're going to see a lot of protocols out there that recommend all kinds of various treatments. And there are some studies that suggest things may help a bit. There are an awful lot of very serious studies, controlled studies that say, no, they're not going to help, including things like ivermectin. There are some things we can do at home, like monoclonal antibodies that have been shown to be beneficial. We're happy to do that for you. You'll see recommendations related to natural things like vitamin C and zinc and vitamin D. They're not going to hurt you. If you decide to take things like that, believe in them. I think that's always helpful to the immune response. But I would shy away. I would agree with what Courtney has said. I would shy away for the things where there's the most controversy, and certainly things like ivermectin is in that category.
And one of those treatments that you mentioned is the monoclonal antibody with Regeneron. Can you explain a little bit more about this treatment and how we're using it at Lakeland?
Yeah, that has been found to be helpful when given to higher risk individuals early in their illness. And that's something that is important for you to know. That's done as an outpatient. So you don't have to be sick enough to be in a hospital to get that treatment, but you have to be seen where a physician is talking to you about potential treatments, given your risk factors, that might help keep you out of the hospital, help you may recover more quickly. So as you see your physician, whether that's in a primary care office or if you're sick enough to be in an emergency room, it's certainly okay to ask, under what circumstances might I qualify, might I benefit from monoclonal antibodies? And your physician will discuss that with you.
And you mentioned this earlier as well, but there are some exciting things happening at Lakeland when it comes to testing for COVID. Can you share more about that?
Yeah, we invested in some new equipment that is able to turn your test around in just a few hours. And we can do 400 tests a day much more rapidly than we could in the past. And we don't have to send some of that volume to Grand Rapids for a rapid turnaround. That's just to help you know how to take care of yourself, and for us to help us know how to take care of you. It's just very useful to get that test as quickly as we possibly can. So it's available.
And Courtney, we've also seen that at-home tests are becoming more widely available. What should people know when using these types of tests?
Yeah, that's a great question. They are definitely out there and available. If you're using an at-home test, these are the rapid antigen tests. Would just really encourage you to follow the directions that you receive with that kit, so you make sure that you're taking and using that accurately. It's also really important to follow through with uploading the results from those at-home tests to the statewide database. That is how that is then reported as a true case. If you don't take this step, it's not something then that can be verified by a healthcare provider or the health department. So it's really important, especially when you're using that for, our school-age families, employment, that you do that reporting step. The other thing is, and we really would want everyone to consider and move forward with being vaccinated, but when you are a case, when you have had that, you do have kind of that 90-day period after being a case where if you are identified as a close contact, you are also not pre-quarantined, right? You have that period of time. And so if we don't have that official report from you doing those at-home tests, that doesn't help us allow that piece of our isolation and quarantine process to move forward. So, follow those instructions and make sure that you are reporting that into the statewide database. If you ever have problems with that, you can also call the hotline and we'll help you hear from the Berrien County Health Department hotline, kind of go over those same instructions and we'll walk you through that, but you have to do that reporting.
Thank you. And now that we are into September, I know there's a lot of anticipation about the start of booster shots. Can you explain what the community should know about that and how these shots are going to be administered once approved?
Well,
Sure.
as we've looked, and I'd be very happy to address a few things there, as we've looked at the immune response related to the vaccine, it's pretty clear that gradually decreases over time. And that will necessitate for longer range immunity. That's going to necessitate a booster. As you know, the president set an expectation to have boosters available by the 20th of September. That's not for the folks that have immune system problems and need a third dose on the initial series. This is just a booster for everybody. And we expect to be administering those to our own staff and across the community. If your vaccine was 3, 4, 5 months ago, you need to start thinking about a booster. If your vaccine was last month, it's not a hurry. Your immune response is going to last for several more months. But those boosters are going to be necessary for long-term immunity. If you've had the disease, even a single vaccine dose significantly improves your immunity. And that's been proven in very large studies. If you've had the disease, your natural antibody response is a very good one. You can enhance it with a vaccine significantly, but you have usually good antibodies. The breakthrough infection rate, if you've had the disease, is only 1 in 1,000, which is pretty good odds. But we expect those boosters to be available soon, and we certainly would encourage you to get yours.
Yeah, Dr. Hamel, those are really good points. I think just from community access standpoint for those, one thing to note with boosters, right now those are not available. I know we're getting calls on that and people are asking to where can they register for those appointments. I'll say hold tight just for a little bit longer. We have a few more weeks. But know that we are actively making plans with partners to be able to host clinics. Those who received the booster or their original doses first are going to be first up for that 8-month booster dose. So there will be clinics available to you. I think one thing for our community just to know is we have a wealth of places to receive that booster, which will look a little bit different than when we started this back in January or February, right? You can go to many pharmacies. There are going to be places that Spectrum Health Lakeland supports, health department clinics, a number of other providers and partners. So the booster rounds of giving out these doses is going to look a little bit different than those mass vaccination sites that we saw originally and early on. So I would just encourage, we will continue to share out information from the health department and medical providers, but we're not quite there yet. So sit tight and watch that. And then just for those booster shots that we're going to see coming out later this month, that is for Pfizer and Moderna at this time. We will continue to watch with Johnson & Johnson, but that is for Pfizer and Moderna at this time where we're seeing that indication of that 8-month booster and being able to mirror that approach. From the health department standpoint, one of our key goals with vaccination has been making it accessible and being out in the community. We're going to mirror some of those same things. We're going to make sure that we are in different parts of the community, that you have access to those. Some of our most vulnerable residents, our older community members, our long-term care facility, they're going to be up first, and we're going to make sure we prioritize those boosters. But know those plans are in the work. Just hold tight a little bit longer while we get to the point of getting them out for the community.
Thank you. And those third doses for immunocompromised people are available now. So can you just remind everyone who falls into that category, and if they do, what steps can they take to get that third dose?
Well, first talk to your physician if you have any concerns about whether you qualify as immunocompromised. But folks that have had are on immunocompromising medications, like steroids, things for kidney transplants, liver transplants. Those would qualify you as immunocompromised. There are certain illnesses that naturally decrease your own immune response. And you would benefit from that third dose. There is no harm. If you've tolerated those first 2 doses, there's certainly no harm in getting that third dose, which is available now if you're in that category. Very soon, it's not going to matter much because it will be the same dose that you get now as the third dose in your primary series or the booster that everybody else is getting. It's all the same dose. And so soon enough, you'll have that available. But if you need it now, if you're in that category, call in and we'll help sort that out with you, or your physician can make a recommendation.
Thank you both, and we appreciate, as always, your time today. I will turn it over to both of you to share any closing thoughts with our audience here today.
Well, I'll give Courtney the last word, but I'm happy to make a comment or two. If you have watched at all what's happening with the Delta strain around the country, you must, like I am, you have to be concerned. What's happening in Florida, in Texas, in other states, they are running out of beds, sometimes running out of resources, having to make tough choices on who gets treatment. This pandemic this surge has been severe, and it is taking lives across the country every day. We hope that it doesn't get as bad in your neighborhood as what we're seeing across the country. I fear that it will. Number one. Number two, we have probably saved 140 to 150,000 lives in this country with a vaccination. It's not a perfect vaccination. Some people have side effects. It is markedly safer than the disease in every age category. The vaccine is between 10 and 100 times safer than taking your chances with a vaccine. Say you're 25. Your chance of dying from COVID is about 1 in 12 or 13,000 at age 25. Your chance for a serious or fatal complication that has any chance of being related to the vaccine, and it's hard to prove one way or the other, there's any chance is more on the order of 1 and a quarter of a million to 1.5 million doses. So you can see it is 20 to 40 times more dangerous to take your chance for the COVID than it is your chance for the vaccine. So, please think hard about that. Talk with your physician about it, your family members about it. I would just encourage, take every measure you can to protect yourself. This vaccine is not over. One way or the other, I believe we're all going to get an antibody. You're going to choose your antibody from the vaccine, or you're going to get your antibody from the infection. I don't think there's any way this pandemic is going to stop until most of us, essentially all of us, have an antibody in our blood to protect us against every or new infections. And you know that a new strain is coming. It's mu. We don't know how severe it's going to be yet. We'll discover that over the next few weeks. It is in all but one state in our country, and in 39 or 40 countries in the world that we know about so far. It's going to become the new strain. And there'll be one after that and one after that if we don't get antibodies across our community. So please think hard about that. And I would encourage you, if you've not had a vaccine, please choose one. We also know that all those isolation or all those protection measures work, like social distancing, hand hygiene, and masks. Are they perfect? Of course not. We're humans. We don't do anything perfectly, but it is helpful, and it helps keep our businesses open and our schools open. And that's helpful as well. So please be diligent with that. Thanks for tuning in. I look forward to seeing you again in 2 weeks.
Thank you for that, Dr. Hamel. Yeah, I think that was well said and summarized a lot of what we talked about here today. I guess I will just add to that is we know as your healthcare and public health partners that we're tired as a community of COVID-19. We know this. It has been a long 18 plus months. We also see this in our own teams and our own staffs. And as our cases continue to rise again, We know that that's the role we've stepped into, to be here to protect Berrien County, to protect our residents, and to be a part of our communities where we want to have thriving businesses and open schools and protected individuals. We know that all of the decisions over the last months and weeks have not always made everyone happy, and we just want to continue to put out there that, you know, our common enemy here is COVID-19, and together we will get through this. We will be stronger on the other side. And so, to Dr. Hamel's point, just continue to urge our community, if you are inside in any indoor settings right now, you know, think about your neighbor, think about your extended family and friends and those you interact with in the community, but put on that face mask. Consider getting to the next clinic to get that vaccine. That is going to help us get there quicker. And do some of those other aspects of social distancing and really ensuring that, again, if you're not feeling well, you're staying home. All of those things, they do work, they do matter, and they just make Berrien stronger. So we are honored to continue to serve our community as your public health and healthcare partners, and just urge you to continue to be in this fight with us, and we will come out stronger on the other side.
Thank you, and thank you for everyone who tuned in to join us today. As a reminder, you can get the most up-to-date information on both Spectrum Health Lakeland and the Berrien County Health Department Facebook pages and online at spectrumhealthlakeland.org/COVID-19 and bchdmi.org/COVID-19. Hope you have a great afternoon.